Yeah, so it's true that when you sign up for CII CPAR, your information is sent to Netcare. And it is also sent to a place called the Healthcare Data Repository. But the information that's sent to the Healthcare Data Repository is governed by a health information data governance committee, and it's used for quality improvement and research purposes. To be perfectly honest, Alberta Health has far more information about billings in their billing data and they don't use this information for that purpose. They don't audit physicians or anything like that. So I think the concern is unwarranted.
So thanks for talking about the repository and the governance that exists around it. So Marco, when you're thinking about the repository and that governance, what comes to mind to you?
Well, the data sent to that healthcare data repository has a clearly documented purpose in the PIA Alberta Health filed with the Office of the Information and Privacy Commissioner. So any use and collection of healthcare information is regulated by the OIPC. And just like you had to file a PIA for use of an EMR in your clinic, for example, Alberta Health had to file a PIA with the OIPC for this system as well. And so, like we said, the use of that data is for very specific purposes only, and that includes system analysis and quality improvement, not for billing audits or any other such purpose. It's also not intended for healthcare delivery. So the healthcare data repository, again, is a database of aggregated healthcare information. It's not an electronic health record like Alberta Netcare, which has the specific purpose of helping to help providers provide healthcare. And there's a different PIA needed for that.
Okay, so when I hear you describe it, it's talking about the billing system, the healthcare repository, and Netcare. So the same or similar data, but different purposes.
Yeah, so an analogy would be something like when you go to your bank collects a lot of personal and financial information about you for specific purposes. But a lot of that information would go to a credit union like Equifax as well. But again, for a different purpose than what your bank might be using it for. But in both cases, the use and collection of that information is regulated by law, and there's very strict regulations about how it's meant to be used.